So Barty Medical actually designed a cotton drug-coated PTA balloon, and it already started the clinical trial before the product launch and approval. My center has been lucky to be a part of this clinical trial. You can say that for the very complex former POP patient, we believe that vessel preparation means a lot. So generally speaking, you know that how should we choose the right tool in treating the foam pop patient? Because the choice of the tools means a lot for the patient prognosis. And regarding the vessel preparation, and when we dilate the balloon, and it's going to rotate, and the tensile damage is going to happen. And at the same time, during the dilation, we're going to have the radical compression damages, especially the plaque and the lesion will be damaged. Well, at the same time, for some of the balloon and when be dilated, and they are going to be having some longitudinal tensile damages. So generally speaking, you can say that for a long lesion, all those damages are very hard to be avoided. But generally speaking, those damages going to lead to dissections, especially for those long lesions, even be dilated unevenly or in some calcified lesion once being dilated, and they're going to be hurt with multiple damages. And for some of those patients, they need the stenting in order to guarantee the patency. If there's no stentings being made in, and the patient even going to have occlusions in the longer run. So even with DCB, we still need to make sure that we do very good vessel preparation. I think this is already become an expert consensus worldwide. Where for vessel preparation, we can use debarking or we can choose different balloon that can do very good vessel preparation to make sure that we deliver the drug to the right place in treating the patient. Well, you can say that for this cotton balloon from Barty Medical, it is different from the traditional balloon. And it has some advantage. Later, I'm going to share with you the advantage of having Barty Medical cotton balloon to help to further reduce the damages to the plaque and to the lesion, which will lay a solid foundation for the patient's better prognosis. You can see that these are some of the real-world study we can see. A typical one is the length of the lesion. The lengths are all more than 20 centimeters, and the patient also have a very severe calcification. You can see that the rate of the salvage stent is still very high. For the long lesion, it's very easy to lead to the dissection. So that's the reason we will need the salvage stent to guarantee the long-term efficacy. And that is the common practice in our daily clinical setting. So as we are in face of the complex FEM-OP patient, they have a very high CTO rate, very severe calcification. That's the reason we need good weapons to take care of those lesions. Well, the cotton balloon from Barty Medical, the reason should we have this balloon, you can say it can help to reduce the vascular injury during the DCB treatment. You can say its design, there are some horizontal and vertical wires that could be formed into a metal mesh. So when we are having the balloons being dilated, we can have an evenly dilation, and at the same time, the drug could also be coated on the surface. It can actually help to reduce the procedure time and also the radiation exposure and the overall cost. So when we are treating the patient with long lesion, I think this cotton balloon is actually an ideal weapon in our hands. We're talking about Barty Medical. These are the advantage of this balloon that can help us to have a good vessel preparation and then drug treatment. What are those advantages? Let's talk about the technical details. This is a metal mesh. And for the metal mesh, once being dilated, you see they're going to have some radical stress during the balloon expansion, and the confined structure of the mesh balloon can effectively controllably and evenly expand the balloon, present the substantial elongation, and in that way, it can significantly reduce the vascular injury and the occurrence of the flow-limiting dissection. When we do the balloon expansion, the less injury we have over the lesion, the less possibility for the dissection. It's also going to significantly reduce the bailout stenting implementation. This is a very special design. I actually saw the chocolate balloon before, But for chocolate balloon, it's not drug coated. For this cotton balloon, it works as a chocolate balloon, but it also have the drug coated features. So you can finish the vessel preparation and the drug delivery for one time. Its thickness of the well is only 0.08 millimeter, and it will not penetrating the intima, and also it can actually have controllable depths and the regular tape, minimizing the intima damage, and also be able to reduce the ring strength and elastic recoil of the lumen, and which going to be a very ideal solution for the vessel preparation. It can also help to debarking some very long lesion, and we now don't have too much of the result in showing how the patient are using this cotton balloon right after debarking, and these are just some of the features we have. In my clinical study, generally speaking, right before using this cotton balloon, we have to use a balloon 2 millimeters smaller than the reference diameter of the target vessel, then to make sure we can have a good patency. You can see that for this cotton balloon, it already have a very limited diameter. On the right upper corner, you can see general balloon, and they have the high pressure area all the way. It's very hard to lead to the damage of the lesion. So for the Barty balloon, it actually can have a very evenly distribution of the strength and the plaque. Once the balloons be expanded, and it still can have evenly expansion, it's very hard for us to 100% avoid the plaque style, but altogether, this technology can help to reduce the possibility of dissection. These are some technical. The structure of the mesh are deflated. Metal mesh are being deflated. Once inflated, and it is just like a small rings to each other. So you can see that it can make sure this distal side is having a small dilator. It's easy to pull back, and I can see that the areas being well controlled. And more importantly, for this balloon, its diameter could be well controlled with high precision. So generally speaking, for such a design, you know that when being inflated and deflated, and the formation of the balloon can still be maintained. In that way, it was also very easy to do the lesion crossover and the retrieve of the balloon to improve the longevity of the product. Another point I'd like to mention is it's a semi-compliant balloon, which can guarantee a very good pressure control. And you can see its diameter has 3 folded wings, and for the 5 to 7 millimeter diameter one, it has 5 wings folded. Once being expanded, and more drugs will be released directly, and you don't need to worry about the toggle. And at the same time, it's also going to have some rotational strength once being expanded. But for Barty, you know that they need to do some very good design. The surface being very well designed. So after expansion, it has a very good folding memory function and easy to withdraw. And more importantly, I mentioned this is a memorable material. It is much easier for you to retrieve it from the patient. This is also a highlight of this product. Where drug coating tactic over this product is also very good. The excipient was also the bromide. The dose of the paclitaxel was 2 microgram per millimeter square, and the coating adhesion is very strong. The drug loss rate is low during delivery, and also it has very good drug transfer to the vessel wall. You can see once being dilated after 30 minutes, the concentration of the vascular tissue was 132 nanogram per microgram, and the paclitaxel could be transferred to the tissue in the form of the microcrystal, and also the so-called stored there for a very long time. And the long-term inhibition of the intimal hyperplasia could also be identified. You know that for Barty, once the balloons being expanded, you don't see any of the drug loss. Where for some other competing product, and they're going to have a very severe drug loss issue. You know that in the folded wings of the Barty Medical, and the design really makes the drug loss rate be minimalized. And from the coating perspective, I see that its drugs being evenly and very strongly adhere to the metal mesh. This is a guide wire and also the drug coating, the metal mesh. And in the proximal and the distal part, you can see that the design, we have the following diameter, including 2.5 millimeter to 7 millimeter, length ranged from 40 millimeter to 200 millimeter. The guide wires, we have 0.0114 and 0.018. Drug dose is paclitaxel 2 micrograms per millimeter square, and also easy for the drug to be absorbed. So to make a very small conclusion, for this product, you can see it actually have the integrated feature from the chocolate balloon and treated with the drug-coated balloon. So drug coated techniques and chocolate balloons being built into one. It also be patented, and it actually have the low stress area, high stress area, and also be able to have a very evenly distribution, and making sure that the stress could be well controlled. In that way, the plaque could also be well controlled without too much vascular injuries happen. So you can say that for this product, along with the drug treatment, it actually shorten the procedure duration and also be able to reduce radiation exposure. This is a very good product. For my center, we also engaged in the product technical feature trial, and these are some of the spec sheet that's been enrolled in this clinical study. All the specs later going to be rolled out in the market. We also hope that we can have some post approval study to show the result. Let me just show you two cases from my center. This is a male, 72 years old, who has IC for 1 year, R3, hypertension, smoker, and you can say that according to the CT, actually he has very severe ischemic issue. For this patient, I don't want to use balloon, but once the patient have a severe dissection, I still worried about it. So let me just use balloon. And you can see this is in the, we do the angiography right before the dilation. We find out there are 3 lesions for this patient, but generally speaking, and it's quite limited. And then we use a very small balloon for the pre-dilation. Generally speaking, the dilation has not yet been well done, especially the distal part has not yet been taken care of. But still, we can use the Barty cotton balloon to cross over. And this is close to 5 millimeter Barty balloon. And because of imaging reason, we won't be able to see the metal mesh. Right after the dilation, you find out the patency is being greatly restored, and there's no dissection ever happen. So for such a patient, if you really want to control the cost without debarking, then for Barty balloon with the vasopressin and drug delivery, it's going to be the ideal turnkey solution. And you can say that sometimes it's not that easy for us to identify the dissection. Well, for this patient, we didn't see any dissection, and which shows very good treatment outcome. And you can see we follow up this patient for 1 year, and still it can still have less risk diagnosis, and the patient don't actually have any need for future treatment, and this patient still be well treated without any bailout stentings being need. This is a second case I'd like to share with you. Female, 80 years old, IC for 3 years, R3, hypertension, diabetes, stroke, and CTA. And you can see that from the CT, the patient has a lot of calcified lesion, and especially for, not many of them are the long calcified lesion. The patient also have a diabetic lesion. So this is patient with a very complex situation. This is actually the imaging. From the imaging, you can see the patient have a 2 proximal occlusion. So we still use a small balloon for the pre-dilation. Right after the pre-dilation, the patient shows good result. And then we started to use the 5 millimeter, the Barty work, Barty balloon. And you can see that right after the dilation, and we have already find out the patient have the dissection issue. And after making the comprehensive consideration, I was quite worried, should we have a bailout stand inside? And especially for those patients who have a dissection, especially at those areas with twisted rings. So we still have a bailout stand being placed. If we need to make sure the patient have very good revascularization. So for Barty Medical, you know that for some patients with a very severe calcification, even if it's limited kind of lesion, but still the severely calcified lesion and Barty balloon can take part of the issue, but not all. The bailout stenting is still going to be needed for this patient.
I think there's a even deployment and also the dissection reduction design, very applaudable, and also vessel preparation plus drug coating technology. It can ensure better results, and in at 6 months. You can see we have with drug-coated stenting for midterm to long term. We are very confident. That's all from me. Thank you very much.